I'm Dr. Anil Mishra, Director of Cardiology at Birla Heart Research Centre, Kolkata. There is a common myth that heart disease is a men's disease and it does not seem to affect women so often. But that's only partially true to some extent, that in premenopausal age, women are protected by God with the female hormones they have. However, this dissipates away when they reach the age of 45 or so. Even before the age of 45, if women smoke or they are diabetic, they lose that advantage. So they become equally at risk for heart disease as men are. If you see in general population, there's a lot of data available from USA where we see that almost 40% of women are affected with heart disease, which is a huge number. And if you see what are the heart diseases, most common is going to be coronary artery disease, but number of them are related to rhythm disturbances, particularly atrial fibrillation, which is also very common in adult males, elderly males. So they also tend to have other diseases of the heart which involve heart failure. So these three are the commonest heart diseases which affect women folk. The problem in women folk is they tend to have slightly atypical symptoms, therefore the heart disease is not identified very commonly. The commonest heart disease, coronary artery disease, often presents as very atypically, like fatigue or extreme weakness, or sometimes just nausea, vomiting and indigestion, and therefore it is not identified as heart disease. They often tend to have atypical chest pain or maybe just shortness of breath on exertion as a manifestation of ischemia, which is not so commonly identified as heart disease. Therefore, it is often missed. It is often underplayed in Indian society because women folk are at home and they tend to have indigestion very frequently, and whenever they have some discomfort in the chest, it is just passed away as indigestion, and they try some local remedies like taking antacids and pudinhala and things of that sort. And for that reason, they often reach hospital very late. The outcomes in CCU, therefore, are not as good as men. And also, the survival and mortality in women folks is higher than in men because of these factors. So do remember, women folks do have heart disease almost as commonly as men, though maybe slightly protected in the premenopausal age, but not beyond that. And they get delayed attention. They pay themselves a delayed attention to the disease, and they get delayed attention from the men folk and the society in general, and therefore they reach hospital late and have poorer outcomes. This can be easily reversed if they are fully aware that they are not protected and the symptoms could be from the heart, and they should seek medical attention at earliest.